I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to the Compliance Divas podcast. I'm Mary Gavoni along with Leslie Canham, and we are going to discuss Awareness Month, which is during the month of May. And hepatitis is something that we sort of take for granted because the hepatitis B vaccine's been in place for quite a long time. And we don't really think about not only the risk of hepatitis B, but the risk of exposure in a dental practice to hepatitis C. But the CDC also talks about hepatitis A and the fact that that can be contracted through contaminated food or water, not in a dental practice, but in our personal lives. Hepatitis is a viral infection of the liver. Untreated hepatitis can lead to serious liver problems like scarring of the liver or liver cancer. Symptoms of hepatitis include fatigue, loss of appetite, stomach pain, nausea, and jaundice. Individuals who have mild symptoms may not know that they're infected at all and may be able to transmit the virus to others. So Leslie, we're going to have you start out with hepatitis A.
Thanks, Mary. Well, hepatitis A is caused by the hepatitis A virus, and hepatitis A is spread when someone ingest the virus. Now, even in microscopic amounts, that can happen. And it usually occurs through close contact, personal contact with an infected person, or by eating or drinking contaminated food or drink. And the best way to protect against hepatitis A infection is by getting a vaccination.
Good point, Leslie. And if there are listeners out there that like to eat raw seafood, like raw oysters in particular, many times they can be infected with hepatitis A and other things. But there is a vaccine for hepatitis A. It's not something that is an occupational illness. And it's usually not as acute as other forms of hepatitis, and it's typically resolved. So people are typically not carriers of hepatitis A. Contrasting that with hepatitis B, also caused by hepatitis B virus, these are all viral forms of hepatitis, it also affects the liver and is a leading cause of liver cancer. About 2 in 3 people may be infected with hepatitis B and simply don't know it, and they can spread it to others through blood and other body fluids. Individuals that are infected with hepatitis B are also at risk of infection with hepatitis D, sometimes called delta hepatitis, which only occurs in the presence of hepatitis B infections. Hepatitis B vaccine is a vaccine preventable disease, and there are several types of hepatitis B vaccines available, including a newer vaccine that only requires 2 rather than 3 injections. And in addition, there is a combination vaccine called Twinrix that is hepatitis A and hepatitis B together. And Leslie, you may have experienced this with some of the practices you work with, that many times with the older forms of the vaccine, we would have a new employee who needs to be vaccinated go through their first 2 injections. And then when it comes to the third one, things kind of drop off. They forget or they don't go for their third injection. So I think that this new Heplisav vaccine is probably a better option for dental practices.
I agree, Mary.
Great. Let's have you, Leslie, talk about hepatitis C for our listeners.
Mary, one thing I want to make a point about with this Hepatitis B vaccination series is that it's from 0 to immunity for those who seroconvert in 4 weeks, 4 to 6 weeks versus 6 months. So it would be the preferred vaccination series to take. With hepatitis C, most people with hepatitis C don't look or feel sick, and they might not even know that they have the virus. If it's left untreated, hepatitis C can lead to serious liver problems like scarring or cancer, and it's one of the most common types of viral hepatitis. So hepatitis occurs in 2 stages. It's acute hepatitis C, when someone first gets infected and may have few or no symptoms, or may have serious illness. And less than half of people who get hepatitis C are able to clear the virus within the first 6 months after infection with no treatment. Most people who get infected will develop a chronic, lifelong infection, and chronic hepatitis left untreated can lead to liver disease, liver failure, liver cancer, even death. So, chronic hepatitis C is the leading cause of liver cancer and the leading cause of liver transplants in the United States. And there is not a vaccination available for hepatitis C at this time. Mary?
We kind of hope with some of the mRNA research that maybe a hepatitis C vaccine could be developed, but so far no results. And one of the reasons why is that the hepatitis C virus continues to mutate. And so you might have a vaccine that works now, but down the road with a mutated virus that may not be. And a lot of times people think back to the hepatitis B outbreaks, and there were several in dentistry back in the 1980s, and still believe that hepatitis B is a big threat in dentistry, which it truly is not now with the advent of the hepatitis B vaccine. But hepatitis C continues to be a threat, and so we need to take those percutaneous or needle stick or puncture injuries very seriously if we're exposed to blood, and follow our protocol for post-exposure evaluation and testing and monitoring for seroconversion with hepatitis C. So to end the public health threat of viral hepatitis, the CDC works with healthcare providers, health departments, community-based organizations to improve viral hepatitis prevention, testing. A lot of people, if they don't know they were sick, don't get tested. There are treatments. Up until probably 10 or 15 years ago, we did not have a treatment for chronic hepatitis C, but we do. We have some very good treatments that actually can clear the virus from people's bodies so that they are considered to be cured. We have great care now in the US for chronic hepatitis C. In April of 2020, the CDC issued recommendations calling for all adults, pregnant women, and people with risk factors for hepatitis C to get tested so that we could have an idea of how many people in the US actually were chronically infected with hepatitis C and they could get into treatment. In July of 2023, the CDC issued new guidance for complete hepatitis C testing to eliminate the need for a separate follow-up appointment for hepatitis C virus RNA testing. So in other words, the testing was done in several steps previously, but now it can be done all in one step. And then in October 2023, the CDC published recommendations that clinicians should test all infants and children 2 to 6 months old born to pregnant women with hepatitis C because it can be passed in the birth canal. And if they have detectable hepatitis C virus RNA, they should be managed in coordination with a healthcare provider with expertise in treating pediatric hepatitis C. Many of the drugs that are used to treat hepatitis C are not necessarily appropriate for infants. So, Leslie, do you have any other thoughts on Hepatitis Prevention Month?
Well, Mary, it's a good call for everyone to practice standard precautions. Treat all blood and body fluid as though it's potentially infectious. It doesn't matter if your patient is 6, 16, or 60. We have to treat all blood and body fluid as potentially infectious. And remember, our listeners should bear in mind that people with acute hepatitis C virus infection don't have any symptoms. Many people with hepatitis C have no symptoms. So if they don't feel sick, how can they let us know that they're sick? And they certainly won't have that indication on their health history form.
What a great reminder, Leslie. So, in this episode, we've done sort of a helicopter view of hepatitis A, B, and C. Remember that both A and B are vaccine preventable, and the hepatitis B vaccine is recommended for all healthcare workers by the CDC and other public health agencies. And OSHA requires employers to provide it at no cost to employees. It's not a mandate from OSHA. that employees have it. It's just the mandate for employers to provide it. And since there is not a vaccine currently for hepatitis C, infection prevention protocols, just like you talked about with practicing standard precautions and all of the infection prevention protocols that we follow, is especially important, and especially preventing sharps injuries as a critical safety issue for healthcare workers. We encourage you to go to the show notes to look at the many resources that are available on hepatitis on the CDC website. And a closing comment that we talked about a little bit before we started to record this session is about all the news information right now about the hantavirus. Hantavirus is a virus that is spread through exposure to mice and their urine and feces. It is typically not transmitted from person to person, although it can happen. And we're not sure yet from the surveillance of the passengers on the cruise ships if that actually was a person-to-person transmission. So we encourage everyone to stay tuned. Follow the CDC website to see if there are more reports on hantavirus. And hopefully we won't have an epidemic in this country, but it seems that there have been already some deaths and some cases of transmission on a cruise ship. So we thank you for listening. The Compliance Divas bring clarity and simplicity to compliance by navigating the regulatory world to keep you on course. You may submit any questions to support@thecompliancedivas.com. All the resources mentioned in this episode are listed in the show notes section. Please review those great resource information from the CDC. And please, if you're listening to us on Apple Podcasts, scroll down and give us a 5-star rating. Show us the love so that we know that we're sending some good messages and some good learning experience for you. Thanks for listening. We'll see you next time.